Good morning, everyone. I'm Nour, and today I'm presenting about telehealth and remote breastfeeding support in the context of Gaza. Okay. We know that Gaza represented a unique challenge, and as Her Highness kindly stated, that mother and baby must be supported, and as GINA, as multi-professionally volunteers, we took upon our shoulders to and willing to fulfill the basic needs for the mother and the babies in Gaza. So we needed to pursue unusual methods. So it was like delivering breastfeeding support through a keyhole for a closed door. So, when GINA team approached the challenge, we thought about this challenge in two parallel lines: the mother-baby dyad and the healthcare workers on the floor. Okay, so we prioritized the remote training of the team on Gaza. So the material was created in Arabic and divided in small bites so it can be delivered remotely to the team. And GINA moderated lively discussions groups on WhatsApp and Zoom for the staff, and created a YouTube channel for Arabic for all the staff, and everyone needed this training support. Now, for the remote training program, now we have 40 health workers trained as GINA lactation advisors, and we also trained, and there's a 100 plus received structured IYCF emergency breastfeeding support training from other NGOs and the Ministry of Health on Gaza. They also conducted a remote stimulation training using dolls and breast models. And as you can see, there was a supported supervision using video calls with the teams annually. Also, we cared about the mentorship for the team on ground. So the remote mentorship with lactation consultant and neologist was a key. And mentorship for the team leaders on management and team building and arrangements there. So we also cared about the well-being support for our team. So they can go through and support the other mothers and babies on Gaza. Also, we have the resource remote team, the remote support service, where the global volunteer of IBCLCs and translators and Arabic translators for the English IBCLCs to support them remotely. So we created a mother-centered bubble when the mother and her baby were seen by our team on the ground and they needed a follow-up and a referral. So we created a system for the referral form for Gaza. When the mother is referred by the team on the ground, the remote team will take and we will build a one-to-one virtual follow-up, okay? And our team will follow up with her privately in her own bubble. And if she needed to be returned to a face-to-face consultation when feasible, that will be also arranged with the team on the floor. And we also provide a multidisciplinary support for lactation advisors, doctors, and translators. And we care also about a warm, continuous contact through calls, voice notes, and videos with the mothers. Whatever she needs, we can and hope to fulfill her needs and fulfill the growth and well-being of her baby also. So we also care to make a virtual peer support groups on WhatsApp for the mothers by collecting their data and asking for their permission on the areas we work on Gaza. They can join the big WhatsApp groups through a QR code or by taking their numbers so the team can add them, whatever the available number they have. Okay, so it is a safe environment for information sharing between each other, and also it's a myth-busting WhatsApp groups. Now we have 4 groups so far, and it is moderated by GINA, infant feeding advisors, a doctor, pediatricians, and a nutritionist. And it's really helpful for them, and we thought that it is a very important source for them to have this support. So let's now talk about the impact highlights we found on the ground. Now we work in 4 different hospitals and 1 clinic in Gaza. And this is our team there with the MSF. As you can see in the picture above, who could say that this picture holds with it a lot of stories behind it for a mother and a baby in the NICU. And it's beautiful to see in a very short period of time that we can see that every baby has his own milk to have and to be supported by the mother's milk. So increase the staff confidence in the breastfeeding support is a key. That's why we see this improvements, and we see that the team cared about because they believed in the breastfeeding support. And also, one of the highlights is there is a sustained support for breastfeeding during the displacement. The mother believed that even I'm displaced, I can breastfeed safely, whatever I am, whatever the situation is. And strengthening the collaborations with the Ministry of Health and MSF Spain was a key to continue this great job. So the cultural change, the mother feedbacks. 97.6% of mothers report that GINA WhatsApp groups as helpful as breastfeeding support. It was a great word, that they found it really helpful. And we also noticed that there is a remarkable increase in exclusive breastfeeding rates since GINA intervention, more than 50% in July, as they were already low pre-conflict, 36 UNICEF 2022 or low. Okay? Also, there's 72.9 received direct consultations from the GINA team in clinical settings. 24.1 didn't receive this direct consultation from the team, but joined the Q&A WhatsApp groups and found it really helpful. Mothers report sustained breastfeeding despite displacement and difficult living conditions. There is part of the testimonials of the mother, and I would love to highlight on one of them that mother said that I thought I would lose my milk after the bombing, but your voice made me believe again. And it's a drop on a river of a lot of testimonials of the mother, and that we help them to regain this hope. So the conclusion we have that telehealth has a lot to offer to the IYCF emergencies that we look to and put a direct light on it. The holistic approach that the circle of love, the mother, baby, dyad needs, and the staff needs need to be met. GINA's model shows that distance is not a barrier. We did it. Protecting breastfeeding means that we are protecting lives, and that what we are hope to continue do that with the support. Thank you. This is our part of our core team and remote team, and some of our GINA team on the ground. Thank you, everyone.